Managing the health of a loved one in a senior living community is frankly a journey marked by incredibly high stakes and, well, all too often just overwhelming confusion. If you're watching this explainer, you probably know exactly what I mean. You step into this world wanting the absolute best for your family, only to find yourself lost in this maze of medical jargon, constantly changing faces, and an alphabet soup of healthcare acronyms that practically requires a decoder ring to understand. But today, we're going to clear that fog. We're looking at a comprehensive guide specifically tailored for Houston families, and it maps out the exact transition from all that confusion to professional clarity in senior care. Okay, so here's our roadmap out of the fog. We'll start with the systemic confusion of senior care. Look at the discipline leadership needed to actually fix it. Explore primary care with FHP, specialist support with Geriatrics, compare the two head-to-head, and then help you choose the right path forward. Section 1. The fog of senior care. We're talking about systemic confusion here. When someone you love transitions into assisted living, families suddenly find themselves basically acting as amateur care coordinators. You're constantly asking these absolutely vital questions. Do my providers actually have a strong support team? Is their leadership actively involved? Do they communicate actively with us, or are they just reacting when things inevitably spiral out of control? These aren't just logistical questions, right? These carry deeply emotional stakes when it comes to the safety and well-being of someone you love. And the source of that fog usually comes down to systemic issues. It's a chaotic mix of new providers, complex medication changes, and completely fragmented communication. Unclear expectations and constant staff turnover make it nearly impossible to find straightforward answers. This is the baseline reality for so many families, but it really doesn't have to be. That brings us to Section 2, Disciplined Physician Leadership. Think of this as the clear beacon. Look at the credentials required to actually steer this ship. The clinical direction behind the services we're about to discuss is provided by a native Houstonian who is deeply rooted in the local community. We are talking about someone who is double board certified in both family medicine and hospice and palliative care. With over 25 years of clinical medical experience, which, to put into perspective, translates to roughly 20,000 hours of training and hundreds of thousands of patient care hours, the expertise here is undeniable. But the absolute core of this entire model is a systems-focused mission dedicated to eliminating those terrifying gray areas in care through proactive intervention and clear, honest communication. Let's move to Section 3, FHP Geriatrics Primary Care. This is your heavy lifting solution. So FHP Geriatrics isn't just some remote advisory board checking in occasionally. Not at all. It's a visiting medical practice providing proactive, in-person facility visits exclusively for seniors residing in assisted living, memory care, and skilled nursing communities right within the greater Houston area. They do the daily heavy lifting of primary care right there in the facility. Now, what's really interesting is how these 5 pillars of care work together seamlessly to catch problems before they become full-blown crises. First, quality. They tailor care plans that align medical management with personal goals. Second, clarity. Families and staff actually get direct access via a dedicated hotline and text line, plus a secure portal for visit summaries. Third, discipline. Utilizing unified electronic records ensures critical health data is never lost in the shuffle. Fourth, harmony. They maintain really strong relationships with major Houston hospital systems, investigating root causes like dehydration or disease progression if a hospital visit does happen, to prevent it from happening again. And fifth, expertise. Using advanced training for evidence-based e-prescribing and, where appropriate, even utilizing the Texas Compassionate Use Program for medical cannabis to improve sleep, pain, and overall quality of life. All right, Section 4, Geriatrics Specialist Supports, an independent expert voice. While FHP Geriatrics is your in-person primary care, Geriatrics is a specialist palliative consultation service. Simply put, palliative care focuses on symptom relief and improving the quality of life at any stage of a serious illness. Geriatrics acts as an independent, completely neutral expert voice for families. Crucially, this independence from hospitals, facilities, and hospices ensures the advice you get is totally free from hidden institutional incentives. And because consultations are conducted via secure video visits, this layer of specialist support is accessible to any adult anywhere in Texas. The source material shares some incredibly poignant sentiments from families that perfectly illustrate exactly when this service is needed. Imagine hearing yourself say, "Our family cannot agree about what to do and our loved one is struggling." Man, that's tough. Geriatrics provides conflict resolution, offering that neutral, expert voice to help families reach unity during incredibly difficult, heavy medical decisions. Or perhaps this sounds all too familiar. We are not ready for hospice, but we also do not want to keep going in and out of the hospital. This perfectly captures why a family might need someone to take a completely fresh look at medications, help safely remove unnecessary ones, and provide serious illness support without completely altering their current primary care setup.
So, what does an Geriatrics consultation actually produce? You get what's called a written plan for recalibration. Following a consultation, which typically happens either every 3 months or right after a significant medical event, this document provides a crystal clear summary of goals, choices, and next steps. It recalibrates everyone: the family, the primary doctor, specialists, home health providers. It ensures everyone is finally on the exact same page, rowing in the same direction.
Section 5. Comparing your care options. Let's look at choosing the right level of support. Looking at these structural differences here really clarifies things. First, the setting. FHP Geriatrics is strictly facility-based, meaning assisted living, memory care, or skilled nursing, and specifically in Houston. Geriatrics, however, can happen in any setting: home, hospital, facility, or clinic, anywhere in Texas via telemedicine. Then look at the duration. FHP is ongoing, long-term, monthly management involved for months or even years. Geriatrics is periodic, stepping in typically every 3 months or right after a major health event to provide consultation.
This is where the fog fully lifts, guys. It's a distinct binary choice based on your current need. Do you need active prescribing and daily coordination? That is the primary focus of FHP Geriatrics. Or, actually, do you already have a primary care provider doing the prescribing, but you desperately need decision support, help with prognosis, and establishing goals of care for a serious illness? Well, that is the focus of Geriatrics.
Section 6. Choosing the right path. Moving forward with confidence. In the complex, often messy world of senior healthcare, clarity is without a doubt a family's most valuable resource. Whether you require the comprehensive, heavy-lifting primary care of FHP Geriatrics within a Houston facility, or the expert, independent telemedicine consultation of Geriatrics to navigate a serious illness from anywhere in Texas, these models provide a disciplined path forward. They literally replace chaos with structure. Before we wrap up this explainer, I want to leave you with a question to really consider. Look closely at the care your family member is currently receiving and ask yourself honestly, is your loved one's care truly focused on their values, their comfort, and their dignity? If you are lost in the fog, it might be time to seek the right, disciplined support to find your way back to what truly matters. Thanks for joining us today to learn about these options.